always start, I find the clavicles, okay? And then you gotta kind of mooch around and feel the bone, and then in between the bone is the second intercostal space, and then you have another bone. So what I do for the second intercostal space, mid-clavicular line, that's your first sound,
That's
right?
pulmonic.
That's your aortic.
I mean aortic.
Yep. I come, this is your sternum right here. You come right across the sternum, mid-clavicular line, same spot, same number 2, and that's your pulmonic. I come down because the heart's sitting on the left side, like this, at an angle. I can best hear the tricuspid, try to do what's right. Okay, that's the fourth intercostal space. And then I just come down one more, I can feel the rib right there. And so I know there's a space, I come across.
And that's
Where you're
Like
going to
the
listen to the
apex.
apical pulse, yep, also known as the PMI, point of maximal impulse. It's also where you might flip your diaphragm to the bell and listen to the mitral valve. If someone has severe,
It's on top of the rib, right? Like right on top of it?
right on top.
Maybe to the side.
They're all, the diaphragm's always going to sit on top of the ribs.
So you were going to say if somebody has a,
so it closes.
I
when
guess,
you listen to
I think you were going to say the radial, the
the
pulses are
the
different.
sound in the heart.
If
And that's
You were about to say, you were
Right, if
checking
there's a
the,
search, where I'm always listening to S1, S2, their
You
apical
open
pulse,
it
I'm putting my
to listen to, like,
stethoscope
soft
here,
sounds.
and I'm feeling their radial pulse, because I want to make sure that they're equal, right, and the rhythm is regular.
So you're listening and feeling.
Yes.
and what's that called if it's not
There would just be an apical radial deficit.
deficit? Okay.
So there's some sort of circulation issue, maybe, there's an artery that's occluded. Or,
And what should you hear when you move side to side? Like a regular, like,
you should, so S1 and S2 are the closing of the heart valves. So S1 is the closing of the aortic and the pulmonic valves, that's our lub. Our dub is the closing of our mitral valve and our tricuspid and our mitral, and that's our dub.
So that's for love
So-
up here and down.
So all these other sounds, like murmurs, we can program this to hear murmurs. You can have a S3, which is, we hear Kentucky instead of a lub dub. That's how they code it. You can hear S4s, but this is advanced. Right now, all I want you to hear is normal heart sounds on each other, okay? Florida is an S4, all right? It's a sound you hear before the lub dub.
and you should have it on the belt to listen to
To
all
hear,
of them.
as you become more advanced in practice, yes, you'll turn it to your bell
Mm.
for heart